Hello and welcome viewers. We are at BW Healthcare World's Oncology Summit 2023. I'm Bhupendra Pantola. We have with us Dr. Vedant Kabra and we'll be talking over cancer with him. First of all, welcome sir.
Thank you, Bhupendra.
So sir, when it comes to a person being diagnosed by cancer, what is the attitude requirement in that person in order to shift his journey from cancer victim to cancer survivor? What would you say?
That's a very important question, Bhupendra. And anybody, whatever the age is, younger patients obviously would be more shocked. But anybody who is diagnosed with cancer is in a state of shock, not only the person but also the family. And it would differ between people because different people have different emotional strength. It is very important to understand, let the things sink in, discuss with your doctors rather than discussing it with people who don't know about cancer, because they are going to sometimes misguide you. They are going to compare you with any other cancer patient within the family, in the society, and cancers are not same in everybody. So talk to the right people, understand what you are having diagnosed with, how it can be treated, what could be the side effects, and how can those side effects be mitigated. Most of the cancers, if they are detected at an early stage, can be treated very well. So again, I would just summarize it: from shock to strength is what we need to go on, because only if you are strong enough, if you can take it positively, will you have a better outcome. Otherwise, treatments are there, they will act on its own, but to add to it, your emotional and your psychological strength is very important.
So, sir, it is said in cancer, not just during the disease, but also during the treatment, the survivor or the patient suffers. So, what have you seen over the time? That is there any mitigation in terms of the side effect? Has it reduced over the time with the newer development? What would you say over that?
So it's not only cancer treatment. Any kind of medicine, surgery, any kind of radiation would have its own side effects. It's true for cancer treatment, it's true for other treatment, and it is also true for treatments other than allopathy. They may claim that it is without side effects, but most of them have their side effects. But a lot of developments have taken place. For example, in chemotherapy, the side effects like nausea, vomiting have practically disappeared. Only a small percentage of patients will have it. An advance to prevent or decrease hair loss by giving scalp cooling. Does not work always, but has worked in many patients. Similarly, surgeries, the extent of surgery has decreased. So from very big open surgeries to laparoscopic to robotic surgeries, from removal of breast and its underlying muscles to removing only the breast or even saving the breast. So the lesser the surgery, the lesser would be the side effect. Right. So this is the way advancements have taken place. But you cannot have a treatment without any side effects. Side effects may be minimal, maybe 5, 10, 15% patients, but you will have side effects.
So at times what we see is celebrities. In this recent case, I'll quote Sanjay Dutt. He has recently said in an interview that because he is a cancer survivor too, he has said that big pharmas have a cure, a silver bullet for cancer, and somehow they are not revealing it. So can there be a silver bullet for cancer? And if some celebrities make remarks like this, what is the influence on the people? What would you like to make the viewers aware of this?
So, firstly, I am not aware of this comment, and if he has indeed made it, I don't agree with it. I am obviously not part of pharma. I am a doctor, and maybe he knows some friends in pharmaceutical industry who have told, but I still don't believe it, because to have a silver bullet or something called Ramban is not possible. Otherwise, humankind will become immortal. Right? You cannot have Ramban for every disease and then you are Amar, which is not possible. So I don't think it is there, and pharma is hiding, because pharma would definitely come out with it. Yes, they may be in the stage of research, they may have better treatment or better drug available which they are still researching, and they will come out with it whenever the approvals are obtained. This is what I would like to think. I don't think there is any silver bullet coming very soon.
So, sir, are there any myths that you would like to burst today? Because at times we see that it is cause of cancer has also been attributed to lifestyle or packaged food if we eat. So there are different research over it. So, what do you think? What is the cause of increasing cases of cancer lately?
There are multiple causes. One is increasing longevity. Now, Indian people are living up to 70 to 75 years of age. Many couple of decades or 3 4 decades ago, it was much less. So, as you age, your chance of developing cancer will also increase. That is one. Second is more screening, more awareness, and more diagnosis. So sometimes, patients had cancer, they were ill, and they used to die without any diagnosis. Those are also adding to the increase. And third, more important, is actual increase, which has happened. There is no doubt it has happened. And lifestyle has a big role to play in cancer in general. In some cancers, much more, in some cancers, much less. Almost 60% of cancers can be attributed to lifestyle, whether it is substance abuse like tobacco in any form, you chew it, you hookah, cigarette, BD, anything, alcohol, obesity, bad eating habits, junk food, processed food you mentioned. So processed food, there is no direct link as yet, but it is processed, it has certain chemicals. Why do we need to consume it on a daily basis? I feel freshly cooked food made out of locally available seasonal food material is the best diet, and that is what used to be recommended in our traditional Indian diet, which we are forgetting. So junk food and drinks, all those things are there, which are increasing the cancer rate, definitely.
So, desi diet, healthy diet. Sir, if you have to point out the problems in healthcare, Indian healthcare system, especially with respect to cancers, and how those problems or loopholes can be rectified, what would you say over that?
The biggest problem is awareness about cancer and its symptoms. Any cancer. There are many cancers which can be detected early, like cervical cancer, breast cancer, colon cancer, oral cancer, prostate cancer. But symptoms are often ignored and they are detected very late. So this is the problem of the general population, and sometimes also of the healthcare system, because they are not aware enough to ask for further tests or refer them to the right kind of specialist. Second is availability. We don't have healthcare available to everybody. If healthcare is available, it is at a very primary stage, and advanced tertiary care and cancer care is not available. The other problem is affordability. Most patients in India are making out of pocket expenses for cancer treatment. So the insurance coverage is not there. Government does not provide universal coverage. They have started Ayushman Bharat, and I hope they take it to a right level and in a right manner, so that maximum people can use it and maximum hospitals can offer it. And more important, we don't have trained personnel also. So a lot of work is needed to be done at all levels, from public side, from healthcare side, from government, and from private healthcare partners, as well as NGOs.
So, adding on to this question, sir, last question for today. What role does preventive healthcare plays in early diagnosis of cancer? And you can also answer this from the point of view of insurance coverage and the PMJ schemes. What would you say over there?
So prevention and early diagnosis are two little different things. Prevention is you are trying to prevent cancer. Early diagnosis is there is cancer and you want to detect it at the earliest possible stage. Prevention, I just mentioned, lot of cancers are because of lifestyle. So if the perfect lifestyle is there, which is not possible, I think, because there are many elements which are outside our control, like pollution, pesticides, or food adulteration. It's very difficult to control them. So even with a good lifestyle, I think you can prevent at least, if not more, 40% cancers. Coming now to early detection, again the role of screening, role of being aware of the symptoms and getting yourself checked is very important for many cancers like breast cancer, oral cancer, cervical cancer, and these are the three cancers which are also on the radar of our government, because they are commonest cancers. Although now the dynamics and the demographics is changing, other cancers are actually surpassing cervical cancer. Colon cancers can be diagnosed, prostate cancer can be diagnosed early. So screening again is very, very important.
Thank you so much, doctor, for talking to us. It was pleasure talking to you.
Thank you.
And that's it from our side. Stay tuned.